Welcome to the NSCHBC Edge Podcast, leading the way in the business of medicine. Now here's your host, Terry Fletcher.
Hello, everyone, and welcome to the NSCHBC Edge Podcast. I'm your host, Terry Fletcher. The Edge Podcast is brought to you today by the National Society of Certified Healthcare Business Consultants. Our goal is to discuss healthy business principles, have conversations on the business side of medicine, so that you and your practice can thrive, be profitable, and successful for years to come. This week on the Edge Podcast, I welcome fellow NSCHBC member Scott Graham. Scott is the founder and president of OMS consulting firm. Scott offers 18 years of practical OMS practice management experience. He has a wealth of knowledge of practice transitions, mergers, acquisitions, recruitment, revenue cycle improvement, billing and coding, workflow optimization, and process improvement training. Scott, welcome to the podcast.
Well, thank you, Terry. It's a privilege and an honor to be here.
Well, we're happy to have you. We don't have too many people in the OMS space, which you clarified for me is oral maxillofacial surgery. So I'm sure there's also a crossover there with dentistry, and then they get into the medical side when we talk about insurance coverage. So this is great. I'm happy to have your experience with us today.
Yes, in fact, that's unique about our specialty because these oral surgeons, as you know, they're a dentist, and then they go 4 more years after their dental training into a specialty such as oral and maxillofacial surgery. So when they come out, we have to credential them both in the medical plans and the dental if they want. Most of them prefer to credential in both medical and dental because, as you know, they're dealing with the facial fractures and biopsies
and so forth. Yeah, my niece is the wife of my nephew. We call her my niece. She is a dentist and just opened up her practice also to OMS surgery. The maxillofacial, and she's like, I didn't realize there was a whole other world of insurance that's away from dentistry. And I'm like, yep, here we go. So I think what would be good today is our topic is really something that's general, but I think your specialized insight and experience in the area will also give some good tips to some of those people that are maybe not be in the OMS space, but are in the space of credentialing and payer contracting. I think we have a lot of providers that believe, I can open up a new practice, I can do this on my own, or they just tell their, inexperienced biller or office manager, hey, I need to be on these contracts without negotiating experience, and I think that runs into some trouble. So let's start with this. So there is a difference between credentialing a provider and contracting, correct?
Yes, that's correct.
Okay, so what do you see in that?
Well, as you know, the credentialing, this has always been a pain in my what, because it is so time consuming.
Mine too.
And tedious because these each insurance companies, they'll send you their contracts, and some of them have been up to 50 pages. But I've noticed there's several tools out there. For example, the CAQH, which allows these providers to put on all their information, where they trained, their licensure, their malpractice. So that helps the credentialing process go a lot quicker. And some of the other insurance companies, if you're dealing with Blue Cross Blue Shield, Aetna, they have another portal of Ability, I believe is the name of that portal. And they're trying to help the credentialing process expedite this, as you know.
Right. And I think just so everyone knows what a CAQH is, because that is a caqh.org. Scott is right. That is actually a tool or website. And it's really what I guess I call it an alliance of health plans. So providers and related organizations, they work together so that the physicians can and any provider, dentists and, the OMS providers, they can put their information in one spot and then you can grab it from there. Is that pretty much correct?
Yes, and that's a great point, Terry. And then it's imperative that you keep track of that because their licensure, sometimes they expire. Their different state licenses, and they're in Missouri is called the BNDD, the Bureau of Narcotics and Dangerous Drugs in different states. As you know, they have maybe 3 to 5 years termination. So you have to keep up up to date with these documents, malpractice insurance changes. So you got to keep that up to date, and it's imperative, as well as if there's any satellite offices that these doctors are going to. So it's a great tool. I really like the CAQH. It's a great tool for those.
It is very helpful, and I just to give our listeners just a little bit of understanding too, because it is free. It's an online profile, but remember, you have to have everything ready before you start to attempt that. You want to have, if you have your NPI numbers, if you've got tax ID numbers, professional liability insurance. I mean, think about what you have to have ready to buy a house. It's kind of like that. You've got to have all your ducks in a row, your business addresses, and one thing Scott mentioned is how you have to keep it up to date, especially with certain enrollment forms. I'm just thinking, Medicare or some of the government plans, Medi-Cal, you have to make sure every location is also updated, and your phone numbers and your bank accounts and all that. So, even though this profile and this tool is great, make sure you have everything ready to do that. So talking about credentialing, one thing that I've noticed is that some groups will hire physicians and they don't check their credentialing first. Have you run into that at all before you try to even get them on a plan?
Oh, absolutely. And that's what we do is when we entertain or even consider hiring a new provider. That's the first thing we do is we'll get a background check. As you know, there's a database out there for any type of lingering malpractice suits or anything to that effect. That's a different
animal altogether.
Yes.
Yeah.
And then there's it's the database, and then as well as the CAQH, because sometimes that may not be up to date. So as you mentioned, credentialing is very imperative that we have to get this before the insurance companies, before you even contract with them.
And it's not just the MD and DOs and the DDS. It's also their mid-level providers that can bill directly to a payer too. Correct?
That's correct.
Okay. Because I know
They're a
sometimes
licensed
that's
practitioner.
Yeah, any licensed practitioners also have to have this credentialing. So, kind of the difference there before we get into contracting, it seems like credentialing means you're kind of getting that, how do I put this? You're kind of getting that provider ready to then say they've been checked through, they're updated, here's who they are, kind of their profile, and then you want to get into contracting. Is that fair?
You're absolutely right.
Okay.
And that's, as you know, before you even entertain the idea of contracting, it's imperative that you get all these where they trained, and it's their life history, basically, either in professional career, that is. As you know, it's just all their information, where they went to school, their licensure, every little thing about their professional life. They want to know that information.
Well, and for the listeners, a lot of them want to say, well, I haven't got them credentialed yet, so can I bill under another provider? No, 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 no. The whole point of getting credentialed is to get those background checks to make sure legally that provider can bill for services. There's not, like you mentioned, any kind of malpractice pending. They haven't been told to opt out of a certain payer. And so this isn't a step you can't gloss over and you can't skip before you get into a contract. Is that correct?
Yeah, you're absolutely right. And we didn't
Okay.
talk about being board certified as well.
Oh, right.
As you know, working with residents, there is a window they have before they become board certified. They'll take their written and then their oral. But I know in some cases, these hospitals won't let them get on staff unless they're board certified. And then same way with these insurance companies. And I say that's just not across the board, but some may require that they're board certified.
I saw something recently, and this is kind of a side note. I don't know if you've ever run into this, but it just brought up something that I was dealing with a client and then a non-client or a potential client. And they told the practice they were board certified. The practice didn't have them prove it with their paperwork and documentation, and they assumed they were, and then the payer found out they weren't, and that was a mess. Have you ever dealt with that?
No, but I've experienced that it's a funny story. I'll digress. As my wife is a physical therapist and was training some individual, and that individual wasn't licensed, so they had trained for all summer for these high school games or fall. Come to find out, to get their licensure, they had to have the the licensed practitioner that they trained under, their information, come to find out he wasn't licensed. So
Oh,
all that training was for nothing.
yeah, everyone on the listeners, you need to verify. Scott could not be more clear on that. I mean, between that and between the client I had, you can't just, there's no saying, oh yeah, I'm this. No, you have to verify, make sure people who they are, who they say they are, and do the background check and make sure. Then credentialing process does that. You go through the credentialing process and they ask so many questions. I mean, they want everything short of your, firstborn child. You've got to really do your due diligence. Otherwise, like, Scott said, you could find yourself in a training program spending all this time, money, and effort and staff time. And then at the end of that, think, oh, no, we can't use this person. So, boy, I've seen that happen. So,
Yes.
yeah, that's not good. So let's move on to contracting. So let's say we did everything we need to do. We got our provider, either MD, DO, any provider that's licensed. We got them all credentialed. Okay, so now we're going to the payers and trying to get a contract, or be basically what it's called is be in network with the plan, which nowadays it's tough because, especially with the No Surprise Act, a lot of the panels for in-network, they're closing them, which has been frustrating. But here's where I was wondering about the challenges you've dealt with, especially in the OMS space. So are the group contracts easier to get versus a contract with a single provider, or do you find that it's not any different?
It's really not any different. I could tell you, when you hire a new provider for your group practice, that is, still the same process. You still have to go through the contracts, and these insurance companies now, with after COVID, we've found that it's taking longer because a lot of these workers are working from home and they don't really have the resources or the infrastructure in place to handle all these requests. So we've found that it's imperative, when you hire a new provider, then if you can get all the credentialing information before you start completing the insurance contract, because that is important as well, and that would take so much time before they're even allowed to see patients.
Yeah, and I think you hit the nail on the head there. One thing I'm still surprised at, the PHE's over and we were 3 years out from the pandemic thing, but one thing I found is interesting is, even when I get a call back from an insurance plan, or I try to call them in customer service, I'm still hearing barking dogs in the background, kids in the back. I'm like, I know you're not in an office setting, so I'm just like, and apparently you're at home, and you know what? Yeah, this isn't working for me. But one of the things on the contract that I was interested in, and I noticed that, I know in my space now, I'm not doing credentialing or payer contracting much anymore unless it's a client who begs. Basically, I usually try to outsource it. But I've noticed that there is a difference, even though it may not be a difference in the work that's done, but the insurance companies seem to have control if it's a group contract, and they like it to stay with the group versus someone who is individually trying to contract, and then a doctor leaves a practice and they want to take their contract with them and they can't, right?
That's true.
Okay, how does that work?
Well, when you say they take their contract with them, I've seen, Terry, where they like to take their fees, what they're getting, reimbursed
Oh,
with them.
right,
And
right.
that doesn't always work. And we've came across that when another doctor would buy, and I'm digressing here, I apologize, but when uh, if there's a merger or another single doc buying out another practice, they may not get those same fees reimbursement. So that's something that you can always reach out, and I would be transparent of what they're getting paid if they're joining another practice, and then now what they're entering. So that's, to me, I would advise our listeners that I find is being transparent, find out from your insurance carriers what the reimbursement is, and then sometimes these older practitioners, they may be grandfathered in some plans that will allow the new practitioners to enroll in.
Okay, and with group contracts, I noticed that they will credential providers enlist them under the group contract. And that's, if it's a big practice, I would say that, if you've got a client that's saying, we're a 10 provider practice or whatever, that is best for the group, but it doesn't, that contract seems to stay with the group indefinitely. But
That's
again, if the
true.
doctor leaves, they have to go then try and get an individual contract at another time, right?
That's correct. If they
Okay.
go, down the street or into another state, as you know, that's when it gets tricky is when they go to another state.
Yeah.
Um, but as far as them going to, let's say, across state, they may not get the same reimbursement they had in a group practice.
Now, what have been and again, I'll just go back to your space because it's so interesting to me that when, again, since I have family members in there, but a lot of dentists didn't realize when they got in the surgery space that it's medical, not dental. But have you had any challenges as far as fees or location as far as negotiating good contracts and fees, or what is your expertise making sure that the payers aren't undercutting physicians?
And I could talk for 2 hours on that particular topic because in oral maxillofacial surgery, a lot of these insurance companies, they're covering their oral surgery services under their medical plans, and the reimbursement isn't as high as, let's just say, if it's straight dental, like for example, another like a Delta Dental, for example.
Right.
So there, we've experienced our specialty is where they, because we extract wisdom teeth, and there's four wisdom teeth, and these medical insurance companies will pay 100% for the first tooth, 50% for the second tooth, because they consider it multiple extractions at the time of surgery. So
Right.
we had to lobby against some of these insurance companies that are doing that to our specialty.
Now, have you seen anything that I've seen I was doing a contract, I think about 6 months ago, and I think I almost fell off my chair. I just couldn't believe this was still happening in 2023, where I had two practices that were almost identical, except one practice had 80% female physicians, and their contracts were lower. Big insurance company. I was like, what? I couldn't believe it. I was like, when did
No, I haven't experienced that at all.
yeah, I just couldn't believe it. And I went to the payer and it was one of the biggest ones out there. And I said, have you noticed that you pay your female physicians less as far as the fee schedule? And they said, well, and they made this thing about, well, we want to make sure that the experience, I go, no, the experience is the same. This is a gender thing. And I was just so floored that that's still happening in 2023. So one thing I guess I would say, and I know that doesn't happen all the time. It was a fluke, I hope, that I found. But, and it was almost $1 difference in the fee schedule. But the one thing that I guess I would tell our listeners, and maybe you could speak to it too, I think sometimes the payers take liberties with contracts that are signed and they adjust them without their knowledge. And sometimes I'll see, EOBs. I said, all of a sudden I'm seeing a reduction in your rates. Did you sign off on this? And they'll be like, no, but then they haven't refreshed or looked at their contracts in a while. And I know that you're in the business of credentialing, and payer contracts. Do you recommend anything as far as how often to go back and take a look at these contracts to make sure that's not happening?
Yeah, very good, Terry. So I believe in transparency, and a lot of times I've seen in practices where you have people, employees doing multiple jobs. Maybe they're wearing five hats, and when it comes to the credentialing and contracting, that's probably on the least of their on the experience level. So they don't have the expertise for keeping track of these contracts, the term limits, and also the fee schedules associated. And that's a great point where it would be nice to keep an eye on what they negotiated, what they promised to pay you, and then comparing that to an EOB when you get compensated, get paid for a service, if that's the same. Because a lot of times I've been to practices that the EOBs don't match the fee schedules, or they're not adjusted their fees. But no, that's a great point. Then I keep an Excel spreadsheet of all the fee schedules for all the different insurance companies.
Well, then you brought up a really good point. So let's say that you are I don't want to say the agent, but let's say that you are the consultant that was hired to be the negotiator for the payer contracts and to create them. Is your role, once the contracts are set, do you continue with the practices and your clients to keep updated on this and make sure you're spot checking, or how does that work if somebody would hire you?
Well, what we do is our scope of work, as I call it, is we will go into a practice, and if they're asking us to look at their insurance contracts and look at their fee schedules, and when we get in, we make a lot of discoveries and save them some money. Potentially, you could negotiate. It's a lot easier on the dental side to negotiate fees with the dental carriers versus the medical. That's in my experience. And so normally when as us consultants, we get in, we get out, and then no, I don't keep unless I have a retainer, or if they ask us to engage in another project down the road. But I bring in to the light to the either the office manager or the doctors, once we established an infrastructure of these contracts and allowed amounts.
Okay, so it's basically that they could continue with you with a maintenance contract type thing, or it could be just the initial setting it up, making sure they know, and then you send them off with, this is what you need to keep looking for. You know, let
Yes,
us know if you need us in the future to help out with that, but kind of like a roadmap to make sure that they continue with what you've negotiated for them. Is that right?
that's correct.
Okay, that's awesome. Well, I think this has been a great discussion and an introductory kind of understanding of credentialing versus payer contracts. I think our listeners are going to be excited about that. And Scott, I just want to thank you for being here and being our subject matter expert today on the podcast.
Well, again, Terry, thank you for reaching out. It's been a privilege and an honor to be on your podcast.
Well, we love having you. This topic could not come at a better time, listeners, with the unrest we're seeing financially in the healthcare and other industries. So we definitely appreciate Scott's time and his insights. To contact Scott directly, go to the nschbc.org website and click on Find a Consultant tab. Type in Scott in the first name field or Graham in the last name field, and you'll have his direct contact information. Also, as a reminder, the nschbc.org website offers free monthly webinars as a variety of topics, as well as the quarterly Medicare regulatory update that I provide for you. Please go to nschbc.org and click on Upcoming Education. So that's it for us today, everyone. Make it a great day, a great rest of your month, and thank you for listening to the NSCHBC Edge podcast. I'm Terry Fletcher.
Thank you for listening to the NSCHBC Edge podcast. Join us on the second Tuesday of each month as our consultants tackle the complexities of navigating the business of medicine. You can reach us on the web at nschbc.org, the National Society of Certified Healthcare Business Consultants.